Hi, I'm Congresswoman Shelley Pingree. I'm so excited to have Kate Ende with me today. She's the policy director at Consumers for Affordable Healthcare, and you're right in the thick of things right now. This is certainly the topic of the week. It's a big focus of the policy debates that are going on in Washington related to the shutdown, and tomorrow is November 1st. So maybe you could just start by telling people a little bit about what you do and why tomorrow is such a big day.
Absolutely. And thank you, Representative Pingree, for having me here today and for all the work you're doing on behalf of Maine people. So, Consumers for Affordable Healthcare, we're a nonprofit, nonpartisan organization that works to improve access to quality, affordable healthcare for all Maine people. We're designated by Maine's Attorney General as the Health Insurance Consumer Assistance Program. So we have a toll-free helpline that provides that anyone in Maine can call, and we also provide in-person assistance from certified Maine enrollment assisters and trained staff that help people understand their coverage options, apply for and enroll in private health insurance, and navigate coverage issues and appeal health insurance denials when appropriate. We also operate the Ombudsman program for Maine Care, so help people apply for and navigate Maine Care coverage as well. Tomorrow is a very big day because it marks the beginning of this year's open enrollment period for 2026 health plans.
Great. So, um, maybe there are different ways that people get their healthcare insurance, and some people will be watching this who know all about open enrollment because they're going to look tomorrow to figure out which plan they want to be on. But other people get their healthcare in a variety of other ways. So maybe you could just describe a little bit about who uses that part of the system. Sometimes people don't even know because we use different names in Maine, like Maine Care instead of Medicaid. They're not even sure exactly which plan they're on. But more importantly, I think it's good for people to have an understanding of like the whole system and the different ways people get their healthcare insurance.
Absolutely. And it can be really confusing because, like you said, there's so many different ways. Oftentimes it's through an employer. Some people purchase individual coverage, often through the marketplace, which in Maine is coverme.gov. Also, people have Medicare, some people have Maine Care, and some people have multiple types of coverage as well. So, open enrollment, we're talking about for people with individual health insurance coverage, both through coverme.gov and any other individual health plan.
Great. So one of the issues that people are going to be confronted with tomorrow, and obviously many people have already heard from their insurer or are, aware of what is about to happen, is that Congress has failed to extend the premium tax credit. So they were designed as part of the Affordable Care Act, which goes back several years, Obamacare, people call it a variety of things, to help people to make sure that your insurance didn't overtake your life, the cost of insurance didn't overtake your life, and really to keep more people in the system because we're facing such high healthcare costs. When Obamacare was designed, that people were worried, well, not everyone's going to get their health insurance, and when not everyone is in the pool, then you have a lot of people who don't have coverage, and for a variety of reasons, it just increases everyone's cost of care. So that's just a sort of overview, but maybe you can dig in a little bit about how those premium tax credits work and why they make such a big difference.
Absolutely. So the premium tax credit, as the name suggests, is the type of tax credit that you can get in advance, and it helps you pay your monthly premiums for marketplace plans. So you apply for the premium tax credits through the marketplace, and if you're eligible, the marketplace will send whatever amount you're eligible for directly to your insurance company, which just lowers the monthly premium amount you're responsible for. The enhanced premium tax credits, authorized by the American Rescue Plan Act and extended by the Inflation Reduction Act, have provided additional premium assistance for those who were already receiving advanced premium tax credits and actually extended eligibility for the tax credits to more people. So now, in this year, more than 85% of marketplace enrollees in Maine qualify for premium assistance.
So that means if the credits aren't there and you previously qualified for them, you can see a huge jump in the cost of your healthcare insurance when you're looking, on the exchange tomorrow. Have you been hearing some stories from people about how that is changing?
Absolutely. So To clarify, the initial level of tax credits, premium assistance that people had access to at the beginning of the marketplaces will remain. So it's that enhanced premium tax credits that's expired. But that has really helped expand coverage to more people and help make it more affordable. And so without the extension of those enhanced premium tax credits, people are going to have to make really difficult decisions. And we know that there are people, and we're hearing from them, that are going to go without coverage because premiums simply will no longer be affordable. More than 50,000 Mainers are currently receiving premium assistance. And for many people, premiums could double, premiums could go up even more. And premium increases are going to be especially high for older Mainers, for Mainers living in rural areas. And for many people, we're talking about increases, several thousands of dollars. So these are not small increases that could be easily absorbed.
Yeah,
And we, sorry,
keep going. No, no, please go.
I say, and we know our healthcare system, as you mentioned earlier, is most effective and most efficient when everyone has access to coverage and can get the care they need in a timely manner.
Yeah, that's such a huge important part of what people often don't see. And I'm going to make sure we talk a little more about that, but just wanted to go back to this question about who is going to be impacted and what you're hearing. I know because we've asked people to tell our office stories, we've really gotten a tremendous number of communications from people who have said, something to us either based on, trying to analyze what they're likely to see on the website tomorrow or what they've already heard from their insurance companies. And as you mentioned, particularly in that older range before you're qualified for Medicare, that's a huge issue right around 60. And also, one of the things that's really struck me is the number of people who've contacted us who said, I'm a small business owner. And I wasn't able to start my business until I knew I could get affordable healthcare insurance. And that's one of the big things that the premium tax credits and the extended ones did, was it allowed people who were earning a little bit more, but insurance was still so far out of range, $20,000 or more a year. It couldn't fit into their family income. And so they were able to do that because of these credits, but now they're going to be confronted with a situation like, oh my God, what did I do? I started my own small business, but now my costs are going to be another $1,000 a month or something that's way out of the range of what they can afford. And I think it's a phenomenon a lot of people don't understand, but maybe you know more about.
No, I mean, access to affordable healthcare contributes to financial stability. It gives people the freedom to be able to make those decisions, to start their own business, to go back to school. It really is at the core of being able to stabilize your family's financial future. And so without that, those choices become very, very difficult for people. And we know, going into winter without affordable healthcare coverage, people are going to have to make really hard choices. Do I pay my premium or do I heat my home? Do I pay my premium or can I put food on the table for my family? And so, we hear from these people that have these impossible decisions to make when assistance is not available.
Yeah, and the other thing you mentioned was within the system now, part of how it works when it does work, and obviously we're all supporters of making it work better. But even today, one of the big concerns is you need as many insured people as you can, because when people are confronted with a choice where it's just too expensive, and then they have to say, I can't have any coverage at all, then they drop out of the system. So you have that many more uninsured people. And maybe you can describe as sort of a system perspective why that is such a huge problem.
Absolutely. So when insurance operates in a single risk pool in Maine, and so usually when people have to make those hard choices, oftentimes it's younger and healthier people that'll say, I'm going to roll the dice and I'm going to not buy health insurance this year because it's expensive. And when you take those younger, healthier people out of the risk pool, it makes insurance for everyone else, all the other individuals and small businesses in Maine that are buying in insurance from that risk pool more expensive. So it increases cost of coverage. And then it also, when people don't have coverage, they're less likely to get preventative care. They're less likely to seek care when an issue arises and might put it off and wait until it becomes not only detrimental to the health of the individual, but more expensive to treat for the healthcare system as well.
Yeah, that's a really important point. And I mean the most important point is sort of the humanity of each individual. Like if you don't get those pre-cancer screenings or you don't get the annual physical or all the things that help people to figure out if there's something going wrong, you do face, deadly healthcare concerns for yourself. But in the system as a whole, we really miss the opportunity to keep more people well. And that's a huge economic issue overall. If we don't have a lot of people getting good health care up front, we really have a much more costly system.
Absolutely.
Yeah, and I think again, it's an impact for each individual, and all of us want, our family members and our friends and neighbors to stay healthy. But it's been a huge concern in Maine. I mean, don't you feel like we're one of the states that really deals with a lot of issues about trying to figure out how to make sure more people get preventative care or have those initial visits or a primary care person that they can turn to, and that's usually an economic decision.
It often is. And, I mean, there's so many other barriers to accessing care for so many people living in a rural area. Are there enough providers? Do I have transportation to that provider? Am I on a wait list? So there are these other barriers, but economic barriers, that can I afford to even go? Can I afford to schedule that appointment is extremely burdensome, and does prevent people from getting the care we need. And, we know that there's a number of Mainers that are, cutting pills in half, skipping doses of medication, not going to the doctor when they need to because they just simply can't afford it already. And so if these tax credits were to expire, those issues are going to become even worse.
Yeah, and just to go back to the politics of this a little bit, I think what's confusing for people is the timing of all this. So, we're currently in a government shutdown. And one of the arguments that we have been making loud and clear is that we had anticipated that the Republicans in this case would come to their senses and say, wow, we really need to extend these credits because it's not a red or blue state thing. It's not, liberal or conservative. Throughout the country, whether it's small business owners, farmers, fishermen, or just a lot of individuals who don't get their health care in other ways, depend on using the exchange and using these tax credits. So we've been arguing we got to do something about it. We're right at the cliff. Speaker Johnson has said to us many times, oh, it doesn't even kick in until December 31st. Why are you fighting over this now? One, we know it takes Congress forever, to come to a conclusion and make this decision. But more importantly, here we are. It's about to be November 1st, and people are confronting this decision and have to make it now. And right now, they're going to go and make the decision based on this idea that the credits weren't extended. So I mean, that's just it's a convergence of politics and the very confusing world of insurance. And you must be hearing from people about, just this dilemma of what should they do?
Absolutely. We're hearing from a lot of people who are very nervous right now. As you mentioned, there's a lot of uncertainty about whether these enhanced premium tax credits will be extended. And right now, we just can't give people a good answer. We're hopeful, but we can't say for sure. And so, having this really big unknown going into open enrollment tomorrow has created so much uncertainty, and it makes it really hard for people to know what the best decision is for their family because they don't have all the information.
Yeah, and if you're looking at if you come in with costs that have, doubled from what you were paying this year for basically the same level of care, or maybe even some people are raising their deductible or doing other things reducing the amount of care, but still having huge increased costs. So you're caught in this terrible place. You're saying, oh my gosh, I don't even have enough money every month to pay for this. But on the other hand, I may have a sick child or I may have long-term illnesses myself or concerns about cancer, or a whole variety of other things. You're stuck in this dilemma of what should you do with all of these unknowns, which is why, from the political side, we feel it's so important to get these decisions made so people know how to go ahead and make these choices. Maybe just to start wrapping it up, I would guess you're really busy right now. So are you guys hearing from a lot of people with a lot of questions?
We're hearing from a lot of people with a lot of questions who are looking for guidance and going into open enrollment. Absolutely.
Well, you provide such a vital resource. So, do you want to just summarize that again? How do people get that assistance? Who do they contact? How does this work?
Absolutely. So people can, if people want to, they can go online, they can look at their options, which I would encourage everyone to do. Even if you're getting a letter from your insurance company saying your premiums are doubling or going up even more, we really encourage people to go to coverme.gov. And it's really quick. You can run an estimate just to see what your plan options are, because there might be another plan that's going to meet your needs that might be more affordable. You never know. So, people can enroll online at coverme.gov. There's also certified Maine enrollment assisters throughout Maine that provide free, impartial assistance enrolling into marketplace coverage. And so you can find a list of those enrollment professionals on coverme.gov, or you can call our helpline with any questions. And we also provide enrollment assistance. And that number is 1-800 965 7476.
Great. Well, that's very helpful. It's really an important service that you provide to people in Maine. And also just, giving some sensibility to this really complicated world of healthcare that we're in now and has just gotten so much more challenging during this administration with not only what we're talking about today, but the proposed cuts to Medicaid, which will kick in next year, which will also impact our system for a whole nother group of people, as well as our overall hospital system and keeping enough money in the pool for the provider. So appreciate that very much. Is there anything else that we should just cover or throw out there, or a policy point we missed?
No, I'd say just thank you again for all you're doing for Maine people.
Well, thank you very much. Thanks for spending the time with us today. And people have those numbers, or if they need to call our office, feel free to do that as well. We're here to help, and we just want to get ourselves through this really challenging time. So thanks so much.
Thank you.